All right, so for planning, during the first 4 hours after a heart cath, what is the nurse's priority intervention? So we talked about this a little bit, right? The first 4 hours, our priority.
Monitor that site.
So what are all the things that we're going to do? We're going to monitor the site, check pulses.
Keep them flat.
We're going to make sure their coags are good. We're going to, you want them on cardiac monitor, right? They got to at least be on tele. What else?
Make sure they remain flat.
Make sure they stay flat. A lot of times they're going to have fluid running at 75 to 150 to flush the dye out. Keep their kidneys safe. All right, so we know that those are all the things that we're going to do. Out of those, what's the priority? If you can't do anything else for this patient the rest of the day, which one thing do you want to make sure gets done?
Make sure the side is not bleeding.
That's the quickest thing that you can do at the bedside without having to do anything else, is to make sure that their site is not bleeding. All the other stuff is super important, but if they bleed to death, then we've kind of messed up, huh? If that wasn't an issue, then you can go down the priority line there, right? Which action does the nurse include in the client's plan of care to best prevent aspiration? So when you're planning care, we talked about dysphagia precautions, right? Now this one doesn't say that the person has a dysphagia diet, just says we want to prevent aspiration. So what kinds of things do you think of automatically?
Elevate the head of bed.
Yeah.
Elevate the head of the bed. Make sure they're awake. If y'all haven't seen this yet, you will. Family members will try to feed people who are asleep. Never understood that, but they do. What else?
It's just to make sure their diet is
Check their gag.
Make sure it's something they can actually masticate, right? Huh?
Check their gag reflex.
Check their gag reflex, maybe make sure they can actually, make sure they can swallow. Now when people come in, especially if there's an indication, you'll go ahead and do a swallow test when they first come in to see how they do. But you can always do that at any point. A swallow test is real simple. You know, they're just taking a spoonful of water off of a spoon and you're just watching to make sure they swallow. That's the essence of a swallow test when they come in. And at any point, you can go ahead and do that again. And you can always make somebody NPO until you feel like they're safe and they can be reevaluated. So to prevent aspiration, if we added to that the patient was in with a traumatic brain injury, does that change your answers? What kinds of things do you want to make sure that goes on with them to prevent aspiration? Traumatic brain injury. Still sitting up high. We still want to make sure they're awake. Is there anything different? Not really. So that's one of those examples of where, like, as long as you understand the basis for what you're doing, it actually doesn't matter kind of what scenario we put with that. Aspiration precautions are aspiration precautions. Which food is included in the client's diet to best promote wound healing?
High protein.
All right, we want protein. We talked about, like, if somebody has renal failure, we have to get creative about how to get them enough protein to heal their wound. What else do you want to make sure they have?
Adequate intake, like just overall.
You want to make sure that they actually are getting enough fluid and food in a day, because they may not be. And fluid is easily important as well to healing, because if they're dehydrated, they're not perfusing that, and it's still not going to heal. A diet of cheeseburgers and pizza. No, why?
doesn't have enough nutrients.
It doesn't have the right nutrients to help them heal. So, you know, it's missing some of the basic vitamins and minerals that you have to have in order to heal a wound. So protein is our go-to, but then what do you do if protein's not there? These are some of the other things that you would have to look at in order to promote wound healing.